The following segment is sponsored by Oakview Medical Associates.
Welcome back. February is Heart Disease Month, so today our discussion with Dr. Nita Bijoor from Oakview Medical Associates focuses on lifestyle medicine for the heart. Good morning, Dr. Nita.
Good morning.
First, let's talk about the types of heart disease. Heart disease covers any disorder of the heart, right?
Absolutely. So heart disease, encompasses coronary artery disease, which is the most prevalent type of heart disease. It also includes structural heart disease, which is defects in the wall, in the valves of the heart. Sometimes those are genetic causes. And coronary artery disease is by far the most important one to consider when we're talking about prevention of heart disease.
Okay, and when it comes to risk factors, you're saying some are lifestyle choices and some are genetic, right?
Yeah, some are genetic. However, we know the power of epigenetics, which means that by modifying your lifestyle, you can actually beat your genes, which is really cool. So, we're not destined to that fate of I had heart disease in the family and that's what's going to happen. It just means that you can be more aware and take better steps, work with your physician or your team of providers to make sure that that doesn't happen, heart disease.
Just being more aware of it is great because you're going to work a little harder at making the right choices.
Absolutely. So coronary artery disease, 1 in 4 deaths are attributed to coronary artery disease in the United States. About 647,000 deaths annually. 1 in 5 of those are silent heart attacks. The top causes of coronary artery disease are diabetes, obesity, physical inactivity, smoking, alcohol use, and just a very sedentary lifestyle. So there are a lot of things we can do.
And, as you were saying, Centers for Disease Control says heart disease is the leading cause of death in the U.S. So what are the symptoms that people really need to be aware of?
So the number one symptom most of us are aware of is chest pain. Chest pain typically exertional, but sometimes it can be very indolent. Also some shortness of breath, just very uneasiness in the chest. Fatigue is another big one. And a lot of times, the symptoms are very subtle. So talking to your provider is very crucial, and we kind of do some risk factor stratification to see if there is a risk, then we're more likely to do some testing and look into that,
Lifestyle medicine for the heart begins with healthy habits. I assume this is going to be one of your recommendations.
Yes. So, coronary artery disease really is a vascular disease. So it's what is going on inside our blood vessels. And the number one cause of coronary artery disease is the inner wall of the blood vessel. There's damage to that. It's called endothelial dysfunction. There are certain things that promote endothelial dysfunction, and for example, processed foods have a very high amount of free radicals and oxidants, not antioxidants. And what that does is it depletes a very important chemical in our blood vessel called nitrous oxide. Nitrous oxide is a very powerful dilator of our blood vessel. It comes to the rescue when there's any blockage. It helps open up the blood vessels, helps them keep them healthy. The good thing is a lot of our foods actually promote a healthy blood vessel lining. For example, this is something that we can adopt into our general daily routine. Eating oatmeal for breakfast. Oatmeal is very high in polyphenols, which is an antioxidant and anti-inflammatory. So it's very good for the blood vessels. Plus, it's very high in fiber. If you add some chia seeds to that, that gives you a lot of omega-3s. Chia seeds, like flax seeds, have a lot of omega-3s, vitamins, minerals. Adding some nuts to the mix will actually give you an additional antioxidant effect. Some fresh fruit like strawberries, we know that it contains a lot of minerals and vitamins. And then having some dried fruits like raisins or craisins, and then a healthy form of protein is almond milk, trying to lower the dairy content in our diet. Dairy, meat, and eggs. What I say is anything that has a face or a mother. Meat is overall more pro-inflammatory, and it's really hard for us to be 100% plant-based, and that's not what we should be aiming for, but it's okay. Don't beat yourself if you're not 100%, but those small steps make a big difference. So,
and this isn't an overwhelming thing to lay out. This is something everybody has access to. It's not a hard shopping list
easily available. Yeah, absolutely.
All right, practicing healthier habits, eating well, you can reverse heart disease or prevent it from happening in the first place?
Yes. We consider coronary artery disease actually a foodborne illness. About 85% of coronary artery disease can be totally preventable with healthy lifestyle and choices, you know. So the number one thing that I think we need to focus on is modifying our behaviors. It's easier to tell people, you know, eat this and don't eat this, but what is it that's going to resonate with them in their own personal value system that's going to make that change? That is the most important, and that is the long lasting. I have patients asking me all the time, you know, I've tried this diet, it didn't work for me, I gained all the weight back. It's every diet, every method works. It is what you do with it and how you take it seriously. You know, I prefer not having a stopgap approach. I really want to focus on having a long-lasting approach. So rather than losing 20, 30 pounds in 1 month, I would prefer a more sustained effect of a pound and a half every week. And then we look back 6 months down the road and, you know, we've lost a good bit of weight, and we've normalized blood pressure, cholesterol levels. Another important thing, a lot of people ask me, you know, their cholesterol, what's your total cholesterol? The total cholesterol is the sum of the good, which is the HDL, the bad, which is the LDL, and the uglies, which are the VLDL and the triglycerides in the blood chemistry report. And a total cholesterol of under 150 or an LDL of under 70, actually you can stop plaque formation. So that's something to be mindful of in your blood work, you know.
And I think one thing that's amazing about your practice, you're not just talking the talk, you're walking the walk at Oakview Medical Associates, because you've got a gym in there, and you're also putting in a kitchen. I mean, you want to talk to your patients about these healthy habits, and you're going to have a place to show them.
Absolutely. We're going to have cooking demonstrations. You know, my entire team has become so health conscious. My nurse practitioner now has started making plant-based meals, and just wonderful to see everybody share this philosophy, and that promotes healthy changes in our patients when they see we're all trying to make a difference. So.
Yep. What do you want people to know about Oakview Medical Associates? I think people are getting used to seeing you here on Tuesdays, but for those who aren't familiar with your practice.
Yeah, you know, I really founded my practice as a very personalized approach to healthcare. We're not run-of-the-mill, conveyor belt type medicine. We are an independent practice, so that allows me to work for the patient, not for a hospital system, and really focusing on what I can do for that patient and how the patient, a lot of it is our lifestyle and our social situation that brings us where we are. I had a 75-year-old patient this week that came to me and said, you know, another physician put her on 5 different medications, and she was very upset. All her life she's been healthy, never smoked. And I just had a very nice discussion with her, and we figured out there were about 4 factors that had driven her blood pressure to go up, her cholesterol to go up, and we kind of made a plan, and now we're on the path of reducing her medications. She's feeling much more empowered, like she's back in control, and I think really putting the patient in the driver's seat is what we're about. We are very aware that we need to get to the root of any problem, so we would advise diagnostic testing, but we really, for us, it's a collaboration. I don't say, you know, this is the way or the highway. It's really important to talk to the patient, give them options, and I think that's where we stand apart.
Absolutely, and it always comes across. You genuinely want to help people, and you enjoy what you do.
I love it.
Hearing it
I love it. I mean, I don't think, you know, in my profession, if I can see 25, 30 people a day and participate in their life, what's going on with them, I'm thrilled to do that every day in my life.
An extended part of the family. Yeah. You can get in touch with Dr. Bijoor at Oakview Medical Associates. It's located at 11 Five Forks Plaza Court in Simpsonville, and the number on your screen, 627-0444. Dr. Nita, thanks so much for being here. We'll look forward to having you back next week.
Thank you, and eat this for breakfast.
Good tips. Back to you in the studio.